But thank you very much for joining, everyone. So the title of this is Objective Assessment and Functional Rehabilitation with the PrimusRS. So I know a lot of you are users already, and we've got some other people who are looking to invest in the system. So today's session really is to talk through some ideas. Jeff's joined us from the US, so thank you, Jeff. And he's going to give a short presentation just talking about some of the applications. So hopefully that will help you with this. Most of you again know our company. For the people that don't, so basically the company is here to raise standards of rehabilitation, but with proven innovation. So we work with various different companies around the world, and ultimately our goal is to give the best clinical solutions for both you as clinicians, but also for the patients. In terms of the Primus, so at PhysiQuip, we've been working with BTE for 8.5 years, so since our inception in 2012. Me personally, I've been working with BTE for nearly 14 years now, so I worked with them at my previous company. So know the system really well, know all of you guys really well, so it's a great community. So hopefully this sort of platform can actually help us share some ideas on things as well. Primus is really widely used. If I've not mentioned your centre here, I do apologise, but we've just put all of the put some of the users that we've got on here. So albeit most of them are NHS, we've got a lot in research, got some in sports, charity there, as you can see with Katie Piper in the bottom left-hand corner. So the system is just really to show how widely used it is, and now more than ever is that we still should be focusing on quality rehabilitation, even though that rehabilitation might change slightly. Who knows what's going to be happening with that. So I'm now going to pass over to Jeff, and he can go through his presentation. So I'm going to give you control, Jeff.
All right, thank you, Andy. Good morning, everyone. Can everybody hear me okay? Just a little nod. Very good. If you hear anything in the background, that's our modern day daycare center with Angry Birds and Angry Birds 2 on, so I apologize if that's making any noise. But good morning, I'm Jeff Johnson. I have been around with BT for about 7.5 years and had the opportunity to work with Andy and a few of you all over there in the UK. Always enjoy coming over, so whenever we can, we look forward to getting back there and helping you all who do have a Primus be more successful, and those of you who want to learn more, you know, help you to understand it a little bit better in person. So I'm going to talk just a very little bit about Primus. Andy, do I have control of your screen?
You should have. Is it working? Yeah.
Yep. It's just a little bit of a delay. So for those of you that may be new to Primus or don't understand it, or you haven't been using it too much, really the basic foundation of this is that we're going to provide an objective platform for the ability for you as a clinician to be able to quantify a person's abilities. And if you think of something like a manual muscle test or just trying to grade muscle actions, we typically are going to grade that on a 1 out of 5 level. Somewhat of a subjective measurement there, though we're all pretty consistent with how we can grade those. But the Primus is going to give you that objectivity where you can isolate a function. So let's say we want to isolate elbow flexion, and we can do so, and we get a quantifiable number at what the strength for that motion is. But we can also quantify a job. We can quantify a sport action. We can quantify with isometric strength, with power, with speed, torque, a number of different ways we can actually quantify strength using the system. So it is a dynamometer, which simply means that it's going to measure force, and that force, as I already said, is going to be isometric, isotonic, isokinetic. The real key here is that we're simulating so many different functions. It's not just for knee extension, knee flexion, like some people use it for, and it's not only for just grip assessments like some people think it can be used for. It's really used for everything from pinch grip all the way to dynamic sports activities and everything in between. We have a high usage of this also in worker rehab, as well as industrial rehab. You can adjust the resistance any way that you would like. There is some objective ways that we can talk about later on that you can determine the force if necessary. You can also adjust the force based on the activity. So if it requires 10 kilos of force to be able to push an object or to grip an object, then we can set that resistance. The directions can also be set accordingly. So if it takes a certain amount of force to pronate and a different amount of force to supinate, we can adjust that on the fly. We're always encouraging objective clinical judgment, so you're able to progress therapy. You don't really get down in a rut, bogged down with doing the same thing over and over. After every session, there's the ability to look at work. And we're not going to talk much about that just yet, but work is simply how much exercise is done. So we look at how much exercise is performed and how well that exercise was performed, and that's the power output. And we can then determine objectively if a person is safe to progress to the next level of rehab. We can work on very low speed motions. So if you have let's say you have a muscle recruitment problem with the triceps, you can work at as slow as a possible speed as necessary to really focus on the triceps. Or if you have a high speed function like pushing a sled or lifting a box and it has to be done with quite a bit of force, then you can move at more high speeds. And really your imagination is the limitation of the equipment here. We have people that are teaching us new things with how to use the equipment. I've seen all around the world very unique ways of people using the Primus. And a lot of what I teach when I travel is things that I've learned from you all who do have the system. All right, so how does it apply to today's rehab? Well, I mean, we all know that, I'm gonna start on the bottom here. We all know that the biggest thing in the world right now is COVID-19. And we know the consequences of being bedridden from COVID or from any other comorbidity. Every day that we're bedridden, we're losing roughly 20% of strength. And that's being relatively conservative. We could be losing more. So every day that we're bedridden, we're getting weaker and weaker, and that's gonna have an impact on us when we do recover. So we want to be able as quickly as we can to introduce more functional activities to people as soon as possible. And we can do that with Primus. I don't know if any of you all have seen, if Andy has shared the videos that we have worked on recently, which are some sit to stand, some basic functions with walking, some other functions with the upper extremity that can help these patients and other patients that have been bedridden for a long period of time. Up here on the top, eccentric exercises. Just recently, from the American Physical Therapy Association, we received an update that, this is something we promote heavily, eccentric exercise. Eccentric exercise is the way to go for so many patients, even those that are relatively weak and frail. And eccentrics is so beneficial because you're working at a higher force capacity, typically 30 to 40% stronger eccentrically than concentrically. And you're also doing it without taxing the cardiopulmonary system. So it was found that eccentric exercise were actually more beneficial with general population and treating tendinopathies. And this is just one study. There are countless studies. If you want to get into a conversation on eccentrics, I'm happy to spend a few hours with you all doing that. But just a quick little point of note there for eccentrics. So here we have some examples of the Primus in action. One thing that we have done over just before coronavirus started is we started to look at specific jobs. And in this case, we have an electrician. We break down the physical demands of that job, and we then put it into the Primus. And we start with the very isolated functions. So in the top left corner, I hope you guys can see this relatively well. We have the isolated function of using a screwdriver, but a very small screwdriver to turn a very small screw. And we can simulate that using our Primus head. The head tilts, it goes down, it goes up. We can change the height, very high, very low. And that will give you essentially thousands of different capabilities for setups. We then start to move to more integrated functions. So we have a lever that we need to pull. So we use one of our tools and we're gonna pull down on the lever. We have a pair of clamps here that we can clip the cable and we can use our hand grip for that. And we're pushing, I'm not exactly sure what that thing is called, but that's where all the cable is wound up. So we are pushing the cable using our ladder system. So as you see, you can get very specific. If you understand the job and you understand the demands of the job, you can really get very specific on how you want to simulate your rehab with that individual patient. And here we have 8 different exercises, and it probably took between these 8 exercises, I would say about 4 minutes worth of setups for each, for all of this. And we were able to do 8 exercises in less than 20 minutes. So you really are able to do quite a bit of functional movement in a very short period of time. Just another example, we have a construction worker, once again, looking at the physical demands of a job, so cutting drywall. We use a tool very specific for that, for the motion of the knife. If anyone has ever done drywalling before, you know how much fun it is to do the mudding afterwards. So we've got a cable system that we can use to help simulate that movement of mudding. Here's another example of me doing that. As you can see, very, very specific functions. Next is some general rehabilitation exercises. You know, we all focus on the isolated wrist movement, grip, forearm, elbow. We're going to do all of that, and we certainly can. The tools give you much flexibility to be able to simulate really anything upper or lower extremity that you want. So if you're in hand rehab, there are hundreds of different setups here for you. If you're in lower extremity rehab, another several hundred with the cable system that you can do. There's really no limitation here if you're just upper, or just lower, or just neuro, or just ortho. Okay. Also, a few examples of some sports setups. This was a golf template that we set up. And once again, being very specific, starting with our grip positioning, so we can use the grip tool. We can even put a golf grip on, or golf glove on, to simulate the accurate grip. Here we have an example of, standing on some discs that are going to make more core and lower extremity engagement for this activity. One of my favorites is the chop and lift. So if you're involved in much power performance, or if you're working with a lot of spinal patients, this chop lift motion is a good way to actually look at symmetry between a chop lift position and then left-right rotation. Maybe just a couple quick videos here so you can see actual movement with the Primus. It's an example of the cable being used, a person simulating pushing a cart. Okay, next we have really nice one here. This is changing gears. So a very basic function, especially in the UK, pretty much everyone has stick shifts or manuals. So this is a way that you can get back to simulating the manual transmission for vehicles. Let me just stop these so they don't get distracting. Okay. The chopping motion, so outdoor activities, or if you have someone that's a chef, a cook, you know, they're going to be doing quite a bit of that chopping motion. As you can see, this is everything from shoulder down to wrist. All right, the last one here is I don't know how well it comes across on video, but this is an oscillation. So you can set up the Primus to create a vibration. So this would be a jackhammer. And as a jackhammer is hitting the concrete, there's some recoil. So there's some bouncing back and forth. And that's what this tool is simulating. Okay. Come on. There's a little bit of a delay here. Andy, I might need you to hit the space bar on this one. I think the videos are slowing it down. Thank you. All right, and yet even more. So these are a little bit more, I would say, athletic driven, but still if you have a back patient or even hip patients. So if you want to teach a good squat, this particular attachment here, this is the shoulder strap. It can really help to improve a squat capability because it is taking away some of that outside lack of stability that people have. You're providing that now with the strap. So some hamstring exercises, hamstring curls. This is a gait training setup that we got from a university here in Philadelphia. And this is just doing some lateral stepping. And you can set as much resistance here as you'd like, 1 kilo, 50 kilos, it doesn't matter. I probably wouldn't go that high, but you can certainly set as much resistance as you would like. As a person walks away, you have almost 3 meters of distance that you can work in. But as the person's walking away, they're doing the concentric phase. And as they're stopping, the cable is pulling them back, so they have to eccentrically control themselves going back to the start position of the cable. There's another chop lift motion, some overhead motion, and then climbing the ladder. So when you look at the data that's presented, once again, I don't know how well this comes across on your end. If we need to spend more time on it, we can certainly come back to this and address these. But when we do an assessment, we're typically going to do a 4-part assessment. We're going to look at the isometric strength. That's the max strength that a person possesses. After we do that, we're going to go on and we're going to look at power. How well can that person move? Power is not necessarily specific to just sports and to just athletes. Power is about efficiency. So we're going to do a power assessment, and that's down here. The next thing that we're going to do is we're going to do an endurance test. An endurance test is looking at how much work, which is just how much exercise can a person perform until they start to get tired. So we're not looking at just 5 reps or 10 reps. We could be looking at 47 repetitions. We could be looking at at 3 repetitions. We just don't know. We're going to objectively let that person's muscles tell us how much they can perform. And then the last piece that we may perform is right here. This is a torque versus speed test. A torque versus speed test is our version of an isokinetic test. Isokinetics and isotonics is completely different. We have the ability to measure isokinetic strength and perform isokinetic exercise, but we believe isotonics is the way to go. So our torque versus speed test right here is looking at what happens to force as we increase, what happens to speed as we increase the resistance. As we increase resistance, we should see lower speed, but we should see higher power because we're using higher force output. We should see those numbers go up. So it's a good way of looking at not only functionally how well muscles can perform at high rates of speed, but also if there's a functional deficit in range. So if we're looking at internal rotation, as we get to about 95 to 100 degrees, we may see that there's a weakness there. And so a person may compensate. And as they compensate by using their body, we'll actually see a change in curves. So it's a really nice way to look at what point in range is there a deficit. And that's something that isokinetics does also very well. We're just doing it isotonically. So those are the 4 pieces of an evaluation that we'll typically perform. Once we've done an evaluation, we have some objective baselines of where we can start our exercise program. We may have to start with some passive motion. So up here in the top right corner, we have a CPM exercise that is also using target forces. So if a person's limb weighs 4 kilos, we can set a target force to be 5 kilos, where they actually have to apply 1 kilo of force to either move concentrically or eccentrically through range. That's a really nice way of getting a person moving, stretching out a joint, but also having them relearn motor control. One of the first things that we learn following an injury is that ability to control force, so we can teach that very early on. Another exercise that we can do down here on the bottom right is an isometric line graph exercise. This can be used for isometric exercise, but it also can be used for assessments of people who may not be performing at a consistent level. So a lot more detail can be explained with this one. And then the very bottom graph, that's our isotonic exercise program. You'll see this circle here. That circle is the feedback for how much range a person needs to move through. And if they're completing the range, they'll hear a beep. That beep means that they have hit their targeted point, and then they go back to the start position. The yellow bars that you see on the bottom, those are going to be the work output. So we have a baseline, the person does, let's say 1,000 joules of work. The next time they come in, they're gonna do 1,100 joules of work. So we can set that goal here, and the yellow bars represent those work outputs. So that's just a little bit of the data that you'll see within the software. So really, there's so much versatility here. You can quickly go from one setup to the next. If you feel like you have only 10 minutes with the patient, don't feel like you're not able to still get some objectivity out of the Primus, and you're not able to perform still a few exercises. When you get proficient with the equipment, you'll be surprised at how many exercises you can do in such a short period of time. We're definitely taking out guesswork with looking at the objective measures. And one thing that we hit on a lot everywhere we go is that why we promote isotonics is that people are going to perform in the way that they're trained. If you're only training isokinetically, when you get back to the job, when you get back to your day-to-day living, there's nothing that is isokinetic in day-to-day life. It's a great way to measure maximum strength, yes, but it's not a great way to train back to function. So we believe that isotonics is the way to train back to what we're really going to be doing in the real world.